1 out of 3 American adults has hypertension, but in the African American community, high blood pressure affects a higher ratio of adults at nearly 40%. The question has long been why. Gene researchers at the Coriell Institute in Camden say they've found answers. NJN News health and medical correspondent Sarah Lee Kessler reports.
Blood pressure is 162 over 100. It's a little bit high.
Hypertension, which is a major risk factor for heart disease and stroke, casts a long shadow in the African American community. But now, researchers at Coriell Institute for Medical Research think they know why.
It's a combination of lifestyle, dietary reasons, but also genetic reasons could play a component, and that was the premise of the study.
Coriell researchers analyzed DNA samples from more than 1,000 African American families, half of whom had high blood pressure. Their findings were recently published in a national genetics journal.
And what we found were indeed there are genes that are present in the African American population that elevate the risk of hypertension, but not in Caucasian population.
5 genes to be exact. The researchers found that these 5 sites were located in or near genes likely involved in biological pathways related to high blood pressure.
We're about 99.9% identical. It depends a little bit on what types of variations in the genome you count, but I like that figure. It's a nice round figure, 99.9. But everybody has their personal 0.1% that is different, is unique to you.
Breathe normally.
Heart experts at Cooper University Hospital say the study could have important implications for African American patients with hypertension.
I think that the study sort of suggests the potential for some of the new genomic approaches to really begin to change the way in which we manage patients and sort of help us manage them more individually.
People like Reverend Floyd White, who has a family history of high blood pressure.
It's affected my life in terms of understanding that it's genetically induced. My father has it, my sister has it, my brother has it.
I didn't know I had hypertension. I had a heart attack and then ended up having triple bypass surgery, so my life has done a complete 360.
The hope is that the study could lead to earlier intervention and one day translate into medications that directly target hypertension in African Americans. Sarah Lee Kessler, NJN News, Camden.